Hi guys, welcome to part 2 on this story of ceramides and how they can help your heart. Let's get started.
Although researchers are still learning more about the biology of ceramides, they are also considering the lipids as potential useful indicators to determine a patient's risk of developing heart disease. The standard criteria for determining this risk include the patient's age, sex, if they smoke or have diabetes, and test results for lipids like LDL cholesterol. Nonetheless, not everyone who is in risk is signaled by these symptoms. In reality, only 15% of those who experience heart attacks have any of the typical risk factors. Ceramides could close the gap. Clinical pharmacologist Joe Loxonen of Zora Biosciences and Tampere University and Associates examined ceramide and cholesterol levels in patients with heart disease in one 2016 research. Blood ceramides correctly predicted whether or not these individuals will pass away from heart attacks. One ceramide variation, for instance, had a 16-carbon tail, and its abundance was 17% higher in patients who died than in those who lived. In contrast, LDL cholesterol did not offer any information. The researchers found that it was greater in those who did not experience heart attacks. Several study teams and Loxonen and colleagues have also discovered that ceramide levels indicate cardiovascular risk in the general population. Overall research involving more than 100,000 individuals have supported the prognostic value of ceramide testing, according to Loxonen. It's reasonable to state that the best lipid-based risk predictor for cardiovascular events is the ceramide test. The Mayo Clinic and Quest have received ceramide scoring methods under license from Zora. Mayusin claims that although he and his Mayo Clinic colleagues are normally skeptical of novel medical tests, the evidence supporting ceramide testing was convincing enough for them to begin recommending the assays to patients in 2016. The team was also persuaded by evidence that ceramides may play a role in the development of cardiovascular disease. Mayusin claims that ceramides are more directly connected to the development of atherosclerosis than cholesterol. Considering these benefits, ceramide testing is still in its infancy. Mayusin estimates that the Mayo Clinic does roughly 1,000 analyses each month, primarily in response to internal requests. In contrast, the clinic runs many more regular lipid panels each day. Nevertheless, other service providers are starting to provide ceramide testing as well. For instance, according to Loxonen, almost half of public hospitals and the majority of private clinics in Finland do this. The upcoming market entrance of Quest will boost accessibility even further. Ceramide testing are effectively 3 tests in one, according to Mark Ben, Medical Director of Quest's Cardiometabolic Endocrine franchise. According to Penn, doctors now do separate tests for lipids, blood sugar, and inflammation on most patients in order to piece together a partial picture of their risk for diseases like heart disease and diabetes. However, he claims that because all 3 factors have an impact on the levels, evaluating ceramides offers a thorough evaluation of a patient's risk for metabolic disorders. Nobody anticipates that ceramide testing will replace the conventional lipid panel. Ceramide tests are more difficult to execute because mass spectrometry, which is not often used in clinical labs, is needed. The Mayo Clinic charges approximately $100 for it, which is also roughly 10 times more expensive. It is also unknown how many cardiologists in practice will choose the tests even after ordering them is made simpler. Preventive cardiologist Neha Pajadipati of Duke Health says she is receptive to the notion. Other metrics can be used to identify those who are at risk for cardiovascular disease. Despite one of her patients having inquired about ceramide testing, she claims that she has never had it done and is still skeptical about its therapeutic use. What I would counsel my patients to do with such knowledge has to be made more explicit, I feel. Summers is concerned that certain recommendations based on ceramide data could be harmful. According to studies, people who adopt a healthier lifestyle, increase their physical activity level, or use cholesterol-lowering drugs like statins have a decrease in blood ceramide levels. Exercise is likely safe to recommend, but statins may just be holding ceramides in the liver, where they do a lot of their damage, according to Summers. What is lacking are data from clinical studies that examine whether or if dietary changes and lipid-reducing medications can benefit health in addition to lowering ceramide levels. Loxonin and Associates started the first study in 2020 to attempt and correct such omission. Ceramide levels and 3 other indicators of cardiovascular risk are being monitored in 2,000 individuals with heart disease. Of the patients, half will enroll in a rigorous program that includes twice-yearly coaching sessions on nutrition and exercise as well as regular guidance through a smartphone app. Also, they will receive personalized medicine recommendations for decreasing cholesterol and blood sugar. The other half of the group will continue to see their doctors on a regular basis. The individuals will be followed by the researchers for 3 years, evaluating their rates of cardiovascular events to see if the more aggressive therapy, in addition to lowering ceramide levels, also offers disease protection. Although diet and exercise can lower ceramide levels, other researchers have looked for a more direct solution: medications that stop ceramide formation or degrade the molecules. So far, attempts made by major pharmaceutical corporations to create such medications have failed for a number of different reasons. For instance, in the early 2010s, scientists at Eli Lilly and Company discovered 2 substances that obstruct the SPT enzyme, which catalyzes the initial stage in ceramide formation. These compounds reduced mice ceramide levels by 60% to 80%. But, they also made the animal's intestinal lining peel off, which forced the business to stop further research. According to Scherer, biotechs are now continuing where Big Pharma left off. Centaurus Therapeutics, a business that Summers helped co-found in 2016, has created a drug that blocks Day1, the enzyme that catalyzes the last stage of ceramide formation. Summers notes that his team's deletion of the Day1 gene in rats resulted in no harmful side effects, suggesting that inhibiting this enzyme is likely to be safer than focusing on SPT. According to Jeremy Blitzer, the company's chief scientific officer, Centaurus is now gathering the animal safety data the U.S. Food and Drug Administration, FDA, needs to approve a clinical study. No start date was mentioned, but he did state that we are on a short route to a first dosage in people. Aceragen, another company, is investigating a new substance that degrades ceramides and intends to start a clinical study within a year. The medicine will be tested on people who have fibrosis, a rare and sometimes deadly metabolic disorder that causes excessively high ceramide levels. Although other academics' work is still in its early stages, they are researching several methods for lowering ceramide concentrations. Cardiologist Christian Schultz of the University of Jena and colleagues are working to mimic the benefits of the medication miriasin, which prevents heart failure, slows atherosclerosis, and boosts insulin sensitivity in rats by drastically reducing ceramide levels in the blood. The drawback is that miriasin, an immune system suppressant that was derived from a fungus, was originally considered a therapy for organ transplant rejection. According to Schultz, the negative effects are why the medication was created. Yet, immunological suppression makes people more susceptible to illnesses. Schultz and his colleagues have created a number of compounds using the crystal structure of miriasin's active site as a model. These molecules appear to have the same effects without impairing immunity. 38. After testing these substances in cells, they want to do mouse trials. With their efforts, Loxonin and his colleagues have roughly reached the same point. By lowering the amounts of certain proteins required for ceramide formation, small interfering RNAs are used to lower ceramide levels. It is yet unclear if these efforts will result in useful anti-ceramide medications. Yet the ability of ceramides as danger indicators is already helping people like Blinderman. After learning the results of her test, she started working out more and eating more leaner meats like chicken and fish as well as more green vegetables. It meant a lot to me. I was raised in a traditional family, she claims. Her ceramide score fell from 8 to 1 after a year, the second lowest danger threshold. Her other lipids, including her total and LDL cholesterol, also became better. She attributes her realization that I've got to get busy and get things right to the ceramide test.